I'll be your nurse today. How are you?
I've been better.
Yeah, can you tell me your name and date of birth?
It's Angela. April 15th, 1964.
Angela, it's nice to meet you. What brings you in today?
Just don't feel good. I just kind of feel short of breath. I've been coughing for about 3 days.
Okay.
And just tired and just don't feel good.
Yeah. Does anything aggravate your cough?
No.
Anything in particular? Does anything make it better?
No.
No? Okay. I'm just gonna take a look at your wristband really quick. Okay, everything looks good. Do you know the date today?
It's the 11th, January 11th.
Very good. And do you know where you are?
Marion University.
Great, okay, awesome, sounds good. Well, I'm just gonna ask you a couple questions and I'm gonna do a little assessment just so we can kind of figure out what's going on. But I see your vital signs, it looks like you have a little fever. I saw you took something in the ED. Have you been taking something at home for your fever?
Just once in a while, I wasn't sure what was going on, so.
Okay. Okay, does that seem to help and help you feel better? Are you having any pain?
It seems to have helped with my fever.
Okay, okay, very good. And I see that your heart rate is a little elevated. Are you feeling stressed or anxious about anything?
Just kind of the shortness of breath. Yeah.
Okay, okay, and I see you're breathing a little harder. Okay. When you cough, do you cough anything up, any sputum? What does it look like?
Nasty yellow green.
Yellow green, okay, gotcha. I see that your O2 sat is also a little bit low, so I'm just gonna, check your heart and lungs and then we'll kind of go from there and see what we need to do, okay? Okay, I'm gonna get started. I'm gonna raise your bed up a little bit. Okay. So I'm just taking a peek at your head and your face. I'm not seeing any bruising or any lacerations of any sort, and everything looks symmetrical. I'm just gonna take a peek at some things. So I'm gonna start with your eyes. So if you would look forward for me, I'm gonna shine this light in your eyes, okay? Okay, I'm just making sure that your eyes react to the light and they look equal and they're brisk and they are doing what they're supposed to do. Can you open your mouth for me? Good, just checking your mucous membranes. They look intact and moist, so everything looks good there. I'm gonna listen to your heart, okay? So when you can just breathe as you normally would. Okay, all 5 spots sound good. I'm just gonna take a listen to your lungs while I'm here, okay? So just deep breaths. Deep breath. Good. Deep breath. Good. Do you mind if I have you sit forward so I can listen to the back? Okay, same thing. I'm just gonna go over your back. Deep breaths. Okay, and your back looks good back here. I don't see any bruising on your skin back there, so that's good. Okay, I'm just gonna look at your skin while I'm here. Your skin is dry and temperature feels good. I can feel your turgor. Have you been drinking water? Are you able to keep water down?
Probably not as much. I feel just tired.
Tired, yeah.
Nothing sounds good. You know?
I totally get that. Sorry, I'm just gonna feel your pulses, both sides. Take a peek at your IV. Looks dry and intact. Are you having any pain in your IV site? Nope, no redness or anything, so I'll make sure to flush that to make sure it's patent, but it looks good. I'm just gonna move down to your stomach. Is that okay if I'm gonna lay you back a little bit and take a peek at your stomach? Is this okay with you? Okay, I'm gonna pull this down. While I'm here, let me just check your cap refill. You have pretty nails. Good, all that looks good. Coming back just in time, let me check the other hand. Yeah, everything's good. Okay, I'm gonna lift your gown up. Is that all right with you? Okay. Your stomach looks good. I don't see any bruising or any distension, so that's good. Just gonna take a listen to all 4 quadrants. Listen to those vowel sounds. Okay, listening to the sounds. How has your appetite been? Are you eating as you normally would? No? Okay, I'm just gonna feel around while I ask you a couple questions. Do you remember when your last bowel movement was?
Maybe the day before yesterday.
The day before yesterday? Okay. Okay, everything feels soft. No pain when I palpate? No? Okay. How have you been urinating? I know you said you're not drinking as much water as you maybe should have. Are you peeing as you normally would?
Yeah, it's been dark.
Been dark? Okay, so maybe a little bit dehydrated. Possibility. Okay. Can you grip my fingers for me? Good. Good. Feels nice and strong. And then I'm gonna have you hold your arms up like this, and I'm gonna pull against you, and I want you to resist me. So pull. Good. And then push. Good. Perfect. Okay. I'm just gonna make my way. I'll sit you up a little bit. I'm gonna make my way down your legs and check down here. And are you having any pain anywhere before I assess down here?
I ran into the nightstand last night.
Okay.
I got up and kind of was dizzy and fell against it, so they put a bandage on there. It was kind of bruised.
Yeah. Are you taking anything for this?
No, I don't think I need to. I mean, it hurts, but it's just kind of a bruisey type hurt. Nothing
Okay.
major or anything.
Okay, well, no edema, your skin looks good, no bruising besides the wound, but this looks dry and intact. No edema, everything looks good. I'm gonna have you pull your toes toward me while I resist, good, and then push down, good. I'm gonna check your cap refill. Yep, everything is good. Does this feel the same, no numbness or tingling down here? Was there any numbness or tingling up here, does this feel the same? Okay, good. And so, I'm just gonna, write down all my findings and maybe talk with the doctor, and we'll try and figure something out, and maybe we might put you on some oxygen, just depending, and maybe we'll come get a sputum culture. But for now, your chest x-ray is pending, so we'll take a look at those results. But it looks like your COVID swab was negative, so we will just go from there. But is there anything I can get you right now? No? Are you feeling okay for the most part? As well as you can feel? Yeah.
Not
Okay.
great, but-
Do you have any questions for me? No? Okay. I'm gonna set your bed back down, and I'm gonna go chart those findings, maybe talk with the doctor, but I'll be back shortly, okay? Okay. And put this down. Here is your call light. Call me for whatever you need. Your bed rails are up, and I will see you later. Thank you.
Thank you.